So now I see that Dr. Kanika Turner has joined us, and the name of this session is A Day in the Life of a Family Physician. Well, you got to experience that because she was delayed in traffic. So, one of the realities that you may deal with when you become a family physician. So, I'm going to go ahead and turn it over to Dr. Turner, but I do want to let you know that she was a resident alternate and director on the MAFP board. And that's how I got to know her. She's a pretty awesome person. I tried to recruit her to come to Jefferson City, but she said no. So, and I still tease her about that. So all is good. So I'm going to go ahead and turn it over to you, Dr. Turner, and you can talk about your journey and how you came to be where you're at in your position.
Perfect. Thank you so much. And yes, you still joke with me about that. Every time I visit Jeff City, I am reminded of that. Well, thank you all for having me today. And again, so sorry for the delay. This morning, I was actually giving a lecture to our second year family medicine residents. So I love family medicine, and you will see, as I get to sharing my journey and my story. Family medicine is an awesome career, awesome practice. It fits me and my personality. So much flexibility and things you can do with being a family medicine physician. So I'll just talk a little bit about my journey, and then I'll talk about what I love about family medicine, and some of the struggles that you can potentially face. So for me, I actually, when I went into medical school, I was interested in emergency medicine. Never thought about the idea of going the family medicine route. I was all emergency medicine. I had faculty members in emergency medicine, and that was what I was going to do. And I rotated in that department, and I realized that it was something I didn't too much like it. I was always thinking about what happened after the patient left. It was just that spur of moment, caring for the patient. But in the back of my mind, I wanted to know what happened in the follow-up. I did enjoy the suturing, seeing some of the traumas. But I realized that wasn't for me because there was something inside of me. I just kept thinking about that. So then I changed my mind to say, I'll go into OB. I'll deliver babies. And that's the route I wanted to go that route. So changed my mind and third year, did everything to, go down a OBGYN route and did the rotation. I definitely enjoyed delivering babies. Didn't too much like the OR, but I figured, I can get used to that, or, it may be okay. I knew a few other physicians who, like the OR, or eventually kind of did more, OB compared to the GYN and operating room. And I actually interviewed at a few different residency programs for OB. And it was one interview I was on, it was a comment that was made that just stuck with me, and that made me take a step back to think, do I really want to do this? At that point, just with, personal story, I had my daughter when I was 20. So when I started medical school, she was 4. So I was a single parent, so I had to think about that as well. All of my family was here in St. Louis. And the comment that was made to me, she said, I spend so much time around these girls. We're best friends. I don't even have time for my own husband. And for me, I was like, I don't think I want a life like that, to where I can't even see my family and my daughter. And she was really like, bragging on the residency program. But how I took that, I'm like, I don't think I want to spend this time in residency and not really be around family. Like that was something that was really important, something that I value. So I got back to St. Louis University. I went straight into my dean office on Monday, and I was like, I don't want to do OB anymore. And this was in the middle of interview season, and the deans was like, what? I was like, I don't think I want to do it. It's not for me. So one of my deans, it was so nice. He sat me down and he asked me, he said, if you had the perfect world, what kind of doctor would you want to be? And I sat back, I thought about it, and I said, I want to be in the community, helping people. I want to be able to take care of their family. I want to know what happened to them. I want to be able to do knee injections if they need that. I want to be able to take care of women if they need pap smears done. And everything I was seeing was around family medicine. And so he said, you know what? I think you ought to consider family medicine. And I said, well, I don't think I can do it. I may have to sit out a year. We're midway through interview season. I don't think I'm able to do this. And he's like, sure, you can do anything. Let's switch gears. So he brought in the other deans. And so I had one dean, had to hurry up and change my letter of recommendations. So I had one dean who wrote me a new letter of recommendation. I had a faculty mentor who wrote me another letter for family medicine. So it's kind of like everyone got on board. I had to go back and submit my applications to family medicine programs. I actually ended up submitting to like 10 programs. But of course, at this point, this was November when I made this decision. And so I interviewed at the family medicine programs. I actually canceled all of my OB interviews. And thankfully, I matched into family medicine here at SLU. And it was actually my first choice because I loved SLU had just developed a new curriculum that was focused on the urban and underserved community, as well as based at a FQHC. So I really wanted to do that. And I also had shadowed when I rotated through here during my medical school time. And I matched into family medicine. And I would say that was the best decision that I made. I love family medicine. Went through a residency program. I was the chief resident at our family medicine program, and graduated from the program. I wasn't inducted into AOA. I did a lot with teaching medical students and residents. I really, really wanted my love for family medicine and for the community to really shine through in my day-to-day seeing patients as a resident, and also community work. So even when I was a medical student, I've always been engaged in a community. So at the medical school, we had to complete community service hours. And so I actually developed a health ministry when I was in medical school, in which I partner with a few different churches. I'll come in and talk about health topics, diabetes, hypertension. So that was my really first introduction to really, really being in the community. And that's also when I knew how much I really loved medicine, because sometimes we tend to think of medicine as people always come to us to get the information, but I actually brought the information to the community, to people's homes where they were. And that to me spoke volumes to me. People felt comfortable at asking questions, and it's not in this tense environment, sitting in the exam room. And it was comfortable. It was a open environment, able to talk. You don't have to worry about the 15-minute rule, getting in, getting out. So for me, I really wanted to keep that community part component in my practice. So graduated residency, and I actually stayed here at my clinic at FQHC, Family Care Health Center, which is located in South City, St. Louis. I always wanted to practice in urban, underserved communities, just because I understood the medicine. It was very dear and near to my heart. I started practicing in 2017, and then I got promoted to associate medical director here in 2019. So I was very, very young to be in a leadership role. I also am continuing to do a lot of community work. So here in St. Louis, I talked a lot about opioid use. I went into the communities, into the churches, doing a lot of education around substance use disorders, fentanyl use, how to respond to an overdose. And I actually was able to set up churches to become naloxone distribution sites in St. Louis. And so we all know that naloxone or Narcan is the reversal agent for overdoses, but I was able to do that in addition to a full-time practice. So that's why I say with family medicine, you're able to do so much and able to reach so many different people. And it's pretty much finding your passion. What is it you love to do and holding on to that? And so, so that's why I love family medicine. Right now in my practice, I actually do OB a little bit. I do vaginal deliveries. I do some at the bedside, operative deliveries, of course, no C-sections. So I still got my love for delivering babies. But the unique thing with family medicine is that I get to take care of those babies I deliver. And so I have patients that I was taking care of since residency, since I stayed here. I'm actually still seeing their babies, taking care of them with their second pregnancies. I take care of generations of families. And so it's nice to be able to walk into a room and ask about, Uncle such and such, or ask about grandma, or, see how the kids are doing. And for me, that says a lot. It brings me joy and gratitude into my practice. And especially with the pandemic, I really feel like, I was burning out, and the thing that brought me joy was seeing my patients. I mean, my patients were checking on me asking me, how are you doing? And it's like, I'll walk in and the visit's supposed to be about you, but because I built those relationships, they wanted to know how I was doing. And a lot of my patients, I got COVID in November, and a lot of my patients heard about it because I was out. I had doctors covering for me. And when I actually came back, my patients, a lot of them, I walked in, how are you doing? How's your daughter? And it's just kind of like, it's that family feel. It's not this, uptight and I'm the doctor, you're the patient. But no, patients actually care about you just like we care about them. And to me, I feel like in family medicine, we're the only career that can have that wraparound type feel in the family. Internal medicine is great, don't get me wrong, but they can't take care of the babies they deliver, nor can they deliver babies. So for me, that's something that will continue to include in my practice. I'm learning a lot with the leadership role. So in family medicine, if you want to just practice in a community outpatient setting, you can do that. If you want to do more and take on a leadership role, the opportunity is there for you as well. I have some colleagues who kind of like the law aspect. They bring their MD knowledge to make great changes in regards to policy in law. So family medicine, like I said, you can tell I'm passionate about it and I love it. The only thing I would say about, what's negative about it or something I don't too much, I think it's just, I don't think it's unique to family medicine, but I think it's just unique to being a female physician. We're typically learning how to, balance home life with work life. And I know they're going away with the term work-life balance. Like there's no such thing as work-life balance. It's work-life integration. So I've since I've started to own that trying to do a balance is difficult to actually balance that out because you're constantly doing things. So it's more so how do you integrate your love for your career in medicine with your family and also, focusing on self-care. So that's a big push in a family medicine world. And it's just a reality with being a female physician that's something that all of us that we share and that's unique. So I do say, I think family medicine is a little more generous to female physicians. Some of my colleagues who've had, babies, we actually build into their schedule time to breastfeed. So we support our female physicians here at the clinic. And I think that's huge, being able to put that onto your schedule. So people know, this is your protected time. You don't have to go the whole entire day, a whole entire clinic session. So things like that we're able to advocate for on this level. And I do think family medicine is a little bit more generous when it comes to female physicians. Any questions for me about like my background or things like that? I kind of talked a lot.
So Dr. Turner, as a family physician who has served on the board, you talked about balancing and integrating work life. When you were on the MAFP board, can you talk about your experience with that and the commitment? And Noah Brown, he's on this call as well, and he currently serves on the board, and he is the instigator of these sessions. He has done a great job of coming up with new ideas to share with medical students the practice of family medicine. So we can promote the board a little bit if you all want to share a little bit about what you all have experienced.
Do you want them to talk or you want me to? I can talk about my experience.
Yeah,
and I can
both
open it up.
of you. I mean, both of you, but you can go first.
Right. Okay. Thank you, Noah, for coming. I really, really enjoyed my experience. It was to me, I love going to the meetings. I love being able to go down for Jeff City with the advocacy day and then bring that information back to St. Louis to my colleagues. In medical school, we only focus on the science part, the biology, the medicine. But really, I mean, as family medicine physicians, we can make significant change with state level policies, state level laws that affect the patients that we take care of on an individual level. And that was my first introduction to policy and advocacy and seeing how the laws are structured that can affect people. So that was I love going to anything related to MAFP and, talking to the legislators and teaching me how to do it. And even some of those skills that I learned then are actually skills that I use now when I'm asked to speak or, what is your opinion on X, Y, and Z? So that was one part I felt like that you don't get in residency and you don't get that in medical school. And I think it is key to be exposed to that during your training. Go ahead, Noah.
Yeah, absolutely. Thank you, Dr. Turner, for agreeing to talk. It was wonderful to hear your experiences that got you to family medicine. So yeah, I would just completely agree. It's been an absolute pleasure to serve on the board. Everyone there is so supportive of students, especially of students, but of residents and the younger physicians. And they're all there to help. Everyone is always there to help you, to back you up, just to talk if you need to talk. That's the great thing about family docs. I think they are very personable people, and that's one of the reasons I love family and why I really want to go into family. So yeah, of course, I hadn't realized, Dr. Turner talked about, the advocacy behind it. I hadn't realized, how much there is that medical professionals do until I started to serve on the board. And it's been a lot of fun to be able to learn about that. And I've actually, I haven't been able to go to Jeff City for any testimony or hearings, but I have written letters for the MAFP to submit, or I've submitted letters on or for the MAFP to legislators. So that's been a lot of fun. I've really enjoyed that, and it is a lot of fun. And also, for especially for medical students, the connections that you make on the MAFP are amazing. I've been able to meet physicians from all across the state. Wonderful people, and I've been able to make relationships with especially the physicians locally, but also across the state. That I know that if I needed to, I could call them up and say, "Hey, would you mind if I come rotate with you for a month or something like that?" And they would, if assuming they could work in their schedule, I'm sure that I know that they would do that. So that's been a lot of fun, and it's been a lot of fun to get to know a lot of the physicians and hear their stories. So it's been a lot of fun, and I would definitely, we're going to be electing, like Kathy said, the new student director and resident director at the meeting in July, the end of July. And so I would definitely encourage anyone, that if you're interested in family medicine, even a little bit, definitely apply, because that will really, well, it looks good on application, of course, but it also gives you that wonderful
Right?
experience. It also gives you that wonderful experience with, it really shows you, is family medicine what you want to do? And for me, it's just completely solidified that family medicine is what I want to do.
Thank you, Noah. We do have a comment. I don't know if you've looked at the chat, Dr. Turner, but it is for you. So it's from Bethany. She's thinking about going into family medicine with OB-GYN and pediatrics with an interest in public health. Any advice for someone going down that path or what to focus on in school that would be extremely helpful in the future? Any extracurricular activities, volunteering you'd suggest to gain exposure?
Yes, yes, yes. So I do have my master's degree in public health. So of course I love that aspect too. So I did the dual program that SLU offered back then. It was dual MPH with the MD degree. Definitely a lot of community. So it's two different aspects. So with the public health degree, you can have a focus on policy if you want that. You can focus on the epidemiology aspect. They have other subsets under the public health umbrella if you want to focus on that. So I will say, let's say the school you go to, if they have different subsets, they kind of tailor your experience to that. If you know you like the policy part, then definitely with MAFP, learning how to do the advocacy, learning about those laws, that will be one thing. I think you get that exposure just being a member and a part of MAFP. And even some of the local chapters may also do a little bit of advocacy and things along those lines. If it's more so epidemiology, if that's your aspect, I would say maybe try to partner with your local health department to get some exposure. Sometimes faculty members have projects that's going on. So if you can connect and express interest, maybe you can also get some exposure on the public health aspect by working with faculty members that's already doing some type of work in the community. And a lot of times faculty members love getting students or residents to join in on some particular project. There are some medical schools that have special tracks. So my community service track that I did was in line with my public health degree. And so that worked out for me as well. But because I was in medical school and I stayed, I kind of started this health ministry. I actually used that as my my exposure and project and extracurricular activities, not only to meet the requirements for the public health degree, but also for the MD degree. And of course, writing a statement on that. And my focus when I did the health ministry was particularly focusing on the Black community with the disparities in hypertension and diabetes. So I was able to use that approach, and that served as my research question with utilizing and elevating the church in the Black community. So I'll say find your passion with that, either connect to faculty members. MAFP have a huge database of physicians across the state who may actually be in public health roles. I know here in St. Louis, the St. Louis County, I think she's assistant medical director. She actually went through Mizzou. She's family medicine. So I'm quite sure if someone had reached out to her, she would love for somebody to join or come and shadow her. So that would be my recommendation for that. And then there's another question. I hope that was helpful. Any extra? Yeah, I hope that was helpful. And I see there's another question. Thank you for your time and sharing your story. I second what Bethany asks. And could you also speak about other public health opportunities and ideas one can do as a family medicine physician, especially one with the MD and PhD degree? That's a good question. So I would say all of the opioid work that I did here in St. Louis was also linked to with the public health degree. I think it kind of gave me that leg up at being able to develop a program per se, a community outreach type initiative. So that public health degree did help me with that. I'm trying to think what other opportunities or ideas. I feel like family medicine docs can do so much in the community. A lot of mine is community outreach and community advocacy. I'm trying to think of some of my colleagues, what they could have put together. I mean, if you want to serve in a leadership role, a health director, you can work at the CDC also, if you want to do that. So you actually see that a lot of physicians, after they finish residency, they may practice with direct patient care, maybe like 3 to 5 years. But a lot of them some are staying, of course, with their career, but then you also have quite a few physicians who may switch over to a more leadership role. And that could be the, health director, that could be in an academic institution serving, program director or dean, per se, CDC, a lot of these great health-oriented organizations who need the expertise from an MD to develop their programs. So all of those positions are open to family medicine doctors. I do have one of my colleagues is actually just got promoted to be the medical director of one of the hospitals here. It's actually in Illinois, so not too far from St. Louis City. So if you want a role like that, that's also available for family medicine. So I think it's more so, if you know you like the public health component, I would definitely encourage you to get your MPH degree. It's a lot easier than an MD degree. Trust me, it's not as intense. You'll breeze through getting a master's degree, but it will equip you with tools to be able to think in a public health lens and be able to make these decisions and not just only at the individual level. So I do recommend, if you have a passion for this, take the time to get the master's degree.
Thank you, Dr. Turner.